aren't going to all get that opportunity at the time. But that's why you pay attention in post-conference, because we're going to relate all that information. And yeah, it'll make a lot more sense by the time you get to the final, because you'll have had all the patients by then, but respiratory failure. So that's going to be big on ventilator-associated pneumonia, ventilator management of patients to prevent pneumonia. Hospitals don't get paid for nosocomial pneumonia. And you realize nosocomial pneumonia costs $75,000. So the hospital loses $75,000 approximately per patient who develops pneumonia while they're in the hospital. That would be my pay raise annually. So we would not want that to happen.
You get a pay
I know
raise?
you get $150,000, but I only get $75,000.
You get a pay raise?
Of course. You gotta know the right people. Remember we talked
Right.
about that.
Oh, yeah, that's right.
Okay, the next one are the anemias, and this is a rough one to find. First of all, a lot of people have anemia. Because guess what? We got a lot of renal failure patients, which you're going to have to drag back that renal failure information from last semester. Because you're going to have almost everybody that's in critical care has renal failure, so just keeping that in tune. So that's going to be the number one reason we see anemia. There'll be a few blood loss patients, so GI bleeders, those kind of patients, so you'll see some of those. But anemia, I don't have a lot of really good opportunities, and we don't have gobs of things we can do to help reinforce that. There's not machines. But we have blood transfusions that you need to be paying attention to. So many hospitals are getting in trouble with their inappropriate administration of blood products.
We had a student about 4 years ago that went in to watch one. Nurses were calling it off and everything, and she came out and got me. And she said, I'm just not comfortable with this. They had the patient's armband on the bed. It was the wrong patient.
Oh.
Because they were having trouble with the numbers and everything, and the person was kind of out of it, and that actually happened.
There was also a big problem that happened to Vanderbilt when the tornadoes went through about 10 years ago, where they had such mass admissions that they actually transfused a patient with the wrong blood and he died. So it made major changes happen throughout the entire hospital because it's federally and state controlled. Those are things that should never happen. It's a never event. Ah, there, I got that in. It's a never event. And so you can't, and so is pneumonia, by the way. Pneumonia is considered a never event. So if they have it happen while they're in the hospital, we've done something wrong. And we have the obligation to make sure it doesn't happen. The next is coronary artery disease. This is your MI patients. You should have plenty of opportunity to find MI patients. Okay? That particular situation, MI is still #1 killer in the United States, so it still is a focus. Most money is spent trying to reduce MI, so we got a lot of opportunity, but we are in the southeast. We are in the belt of all the bad stuff that increases your risk of coronary artery disease, so therefore we get plenty of them. And there are very specific standards of what should be maintained, and the ED does an exceptional job here in maintaining those standards. See,
Props.
the cath lab does a great job. I mean, we've seen people, we've been lucky on some clinical days where our nursing student in the ED has the patient come into the ED. They're there for less than 60 minutes. You can't be hanging out there if you got an MI. Then we have another nursing student up in the cath lab, and they get to see them in the cath lab experience. And then we have another nurse that's in the coronary care unit where they're going to be transferred as soon as they get past the cath experience. So it's really kind of good because in post-conference then we can talk about the whole, because that should all happen in probably less than 90 minutes. We should have the whole
And they're dropping
transition.
it now. They're dropping it again.
Yeah.
Yeah.
Well, Vanderbilt was doing 45 minutes always from ED to balloon, but there's lots of places making it 30. So the point is 90 minutes by the time they reach the critical care unit, which is pretty good with intervention.
And here is your chance. She'll talk more about a prioritization, but going back to the ED, which is my specialty and my love, but
Turn that
you
tape.
have to.
ED's wonderful.
Anyway, you get to see on the floors and everything, but how everything is supposed to work together as a team. We joke and kid back and forth, but if someone dropped right now, we would work as a team. Don't be that nurse that, oh, I'm not paying any attention to that one. Well, did you check their bottom? No, I was saving their life. That's the kind of thing that does go on. When you're in ER, you may have unfortunately, lately 4 or 5 patients, but you've got one that's got to have antibiotics. Boom. Blood cultures have to be drawn before you can give the antibiotics. You know,
Within 60 minutes of arrival.
yeah, and I mean, you're hitting all these times. You're hitting stroke times. You're hitting MI times. You're hitting pneumonia
Septic,
times.
Sepsis time.
All of this is going on. So here's your chance to get a feel of what it's like to be a nurse. They're not going to have time to hold your hand. They're not going to have time to, come and get you from the desk. Get in here now. No, you stay on top of stuff. And I can tell you that I will find out who it is, and this has been done in the past, if I have a nurse like, did you have a student up here the other day? And it might have been from another clinical, said, they just sat and doodled on their pad. They said, oh, I've done that before.
You
Not
get a
gonna
chance
fly.
to do it again to perfect it.
Not gonna fly. Everyone's different, and the person you're going with is gonna have a technique that might work. Anyone left-handed in here? Try to find you a left-handed nurse sometime this semester. Try to find you a left-handed nurse sometime this semester. Especially when you get these older, either of y'all at Greenview with Miss Mitter?
Yeah, better.
You can, Nicole, there's several of them. No, Penny's left-handed. But there's several people that are left-handed. They do it totally different. Your skills and stuff, it's gonna be like, oh, this was easy. Had someone who was a respiratory therapist and the left-handed nurse showed her a trick on how to put the blood pressure cuff on. Think about it. Everything's designed for a right-handed person. Every video you watch, right-handed person. All the skills are demonstrated, right-handed. Hook up with an experienced left-handed nurse. They got all the tricks down. Judy Walker, if you get a chance to talk to her sometime, she's on, is it optional retirement? She's left-handed, would love to tell you tricks of the trade. Makes your life a whole lot easier.